My name is Kausar Khan, as shown here also. I'm with the Khan University in the Department of Community Health Sciences and one of the partners of WEMC. And the WEMC research framework, as part of community health sciences, we do relate it to health. But then I just want to flag that when I say health, in community health, health is the whole concept of well-being. And with community participation as very, very central, the focus is automatically on women because measurement of health is the maternal deaths as a very standard way of looking at it. So it allows for a fair amount of flexibility. I think that's about my work here. Here in this presentation, very quickly, this is really a work in progress, what I'll be sharing with you. And I said that we are looking at taking Pakistan as a case study in view of what Vivian had presented. And as a work in progress, it is really an interpretation of what we are doing in the actual field sites. And in doing that interpretation, we use, our team has been using three very key, what I consider very key frameworks of analysis that the framework gives us. One is, in a more simpler way, what supports women's assertion of their agency, of their right to decide, this is how it translates when we look at empowerment in our own local languages, and also what are the barriers. Then what is very significant, I find, in the WEMC framework of analysis, one angle is to look at this distinction between what is happening at the micro, how the micro is being ruled or controlled by meso, and what are the macro, where the policies, the state policies emerge. So I find a very useful framework for analysis. And the third one is, which also Vivian flagged, is when we are looking at the process of change, then it is from the individual to the collective to the organization to institutionalization. And in our experience, we have found the starting point as a collective or an organization, but again, as a framework of analysis, we find that very useful. So what I'm presenting here, I just have 4 slides. If you look at in Pakistan, as a Pakistan case study, we have some social movements, the national one. For instance, women's movement in Pakistan is really, its heart is through these 5 city chapters, and these are all urban chapters where then we have the lawyers movement, which really started, which is the new one in 2002, and it is really a large national movement. And I think we must remember there's this religious fundamentalism also as a movement. Somebody in Pakistan said in Pakistan there are really 2 movements, the mullah movements and the women's movement, and the 2 are at loggerhead with each other. And it's very important to see that when we look at these movements, how the religious movement penetrates the micro far more than the women's movement or even the lawyers movement penetrating the micro. And when I say micro, then I'm talking about urban poor and the rural poor, not the power groups within that. Now, in our work, what is I've labeled it is this is emerging alliances at the micro level. For instance, our field size macro level, directly we're working with women and men in a rural setting, and interestingly, it is a village within the administrative area is also completely rural. Then a women's organization in that district, and this is young women organized around agriculture, work on pest management and looking for alternatives. So they work at the village level, but on this issue of the use of pesticide and its impact on people's life. And then there is this federation of 3 rural development initiatives, again in this one district, rural district, and where there's the peasants organization, which has some women, and we are linking up with them. They're the government agricultural development, their staff, and they also have women. So we've said that we will work with the women's group, women within that, and they're okay with it. And also a local university, because we're also, in a way, struggling that when we look at the process of individual, collective, group, and institutionalization, how will we interpret institutionalization? And we are looking at one way currently is to see which institution will carry forth the sort of work we are doing. So we've been talking to the Vice Chancellor and she happens to be a woman, the first woman Vice Chancellor in Sindh, on partnership with them